Hi, you are watching COVID Update and this is Sana Haroon. Since last week, Canada has seen an 11% increase in COVID-19 cases, announced the country's top doctor, Theresa Tam, on Friday. Health officials expected turbulence with the pandemic due to bumps in the case trajectory seen in the modeling data.
Thank you, and bonjour à toutes et à tous.
Hello, everyone.
It looks like we may be experiencing a bit of turbulence this week. As we said during last week's modeling update, there may be bumps in our trajectory over the coming weeks, with further easing of public health measures, and as we spend more time indoors during the cooler weather. Over the past 7 days, an average of close to 2,500 new cases were reported daily across Canada, which is 11% higher than last week. Currently, severe illness trends are stable, but we need to keep infection rates down to prevent increases. Over the past week, on average, over 1,800 people with COVID-19 were being treated in our hospitals each day, with 528 in intensive care units and 22 deaths were reported daily. Over 28 million people, or 85% of the eligible population aged 12 years and older in Canada, are fully vaccinated with COVID-19 vaccines. However, we still have sizable gaps in vaccine coverage. This includes over 5 million eligible people and over 4.3 million children under the age of 12 years. This means total population coverage is about 10% lower, with over 74% of the Canadian population fully vaccinated. Most notably, coverage is not the same everywhere, and where there are pockets of very low coverage, there is a higher risk of local surges in virus activity.
Il semblerait que nous pourrions connaître quelques perturbations cette semaine. Comme nous l'avons dit la semaine dernière lors de la mise à jour sur la modélisation, nous pourrions voir des fluctuations dans la trajectoire au cours des prochaines semaines en raison de l'assouplissement des mesures de santé publique et du fait que nous passons plus de temps à l'intérieur avec l'arrivée de la saison froide. Au cours de la dernière semaine, près de 2500 nouveaux cas ont été signalés en moyenne chaque jour au Canada, ce qui représente 11% de plus que la semaine dernière. En moyenne, plus de 1800 personnes atteintes de la COVID-19 étaient traitées dans nos hôpitaux chaque jour, dont 528 dans les unités de soins intensifs et 22 décès ont été signalés quotidiennement au cours des 7 derniers jours. Plus de 28 millions de personnes, soit 85% de la population admissible âgée de 12 ans et plus au Canada, sont entièrement vaccinés contre la COVID-19. Cependant, la couverture vaccinale présente encore des lacunes importantes. En effet, plus de 5 millions de personnes admissibles et plus de 4,3 millions d'enfants de moins de 12 ans ne sont toujours pas vaccinés. Ainsi, la couverture vaccinale totale de la population canadienne est environ 10% plus basse, soit plus de 74%. De plus, la couverture vaccinale n'est pas la même partout au pays. Dans les régions où la couverture est très faible, il y a un risque accru de recrudescence locale de l'activité virale. Dans les semaines à venir, à mesure que le temps se rafraîchira, nous ressortirons nos vêtements chauds pour profiter confortablement du grand air. Dans le même ordre d'idées, nous devrons penser à ajouter des couches de protection contre les infections respiratoires qui peuvent se propager plus facilement lorsque nous sommes à l'intérieur où la qualité de l'air peut être moins bonne. Depuis le début de la pandémie, nous avons beaucoup appris sur le virus SARS-CoV-2, à l'origine de la COVID-19. Surtout, nous avons appris que le virus peut persister dans des films aérosols et rester en suspension dans l'air ambiant, tout comme la fumée expirée persiste dans les espaces mal ventilés. Comme c'est le cas pour la fumée secondaire, les personnes qui se trouvent à proximité de la personne atteinte du virus inhalent davantage d'aérosols. et pourquoi le fait d'ouvrir une fenêtre aide à réduire les risques et pourquoi le port d'un masque bien ajusté et bien conçu est si important lorsque vous passez du temps dans des espaces publics intérieurs, en particulier si la ventilation n'est pas optimale. Si la vaccination nous fournit une protection immunitaire de base, les masques constituent une barrière extérieure essentielle pour éviter d'inhaler le virus et de le propager d'une personne à l'autre. À l'approche de l'hiver, nous avons de nombreuses raisons de nous assurer que notre barrière extérieure est de la meilleure qualité possible et qu'elle est adaptée. Le variant Delta, hautement contagieux, continue de prédominer et le risque de recrudescence de l'activité de la maladie est susceptible d'augmenter avec le temps passé à l'intérieur, en particulier dans les régions où la couverture vaccinale est faible. De plus, comme la protection conférée par les vaccins semble s'affaiblir dans certaines situations, le risque d'être gravement malade pourrait également augmenter, ce qui justifie la nécessité de multiplier les mesures de protection. En particulier, en ce qui concerne les différents masques, ceux qui s'adaptent parfaitement à votre visage et qui sont fabriqués avec des couches de matériaux capables de filtrer les fines particules virales sont les meilleurs pour prévenir l'inhalation des particules respiratoires infectieuses ou réduire la quantité des particules inhalées. Pour rester en aussi bonne santé que possible cet automne et cet hiver, il faut se faire vacciner contre la COVID-19 et la grippe saisonnière sans négliger les autres mesures de protection, comme se laver les mains, améliorer la ventilation dans des espaces intérieurs, éviter les lieux bondés et porter un masque de bonne qualité lorsqu'on se trouve dans les lieux publics ou privés avec des personnes qui ne font pas partie de la famille. Lorsqu'il s'agit de votre santé et de celle de votre famille, plus il y a de mesures de protection, mieux c'est. Pour en savoir plus, consultez le site canada.ca qui contient des renseignements et des outils à jour pour vous aider à choisir un masque bien conçu et bien ajusté qui vous assurera une protection optimale. Merci. Thank you. Miigwech.
Alberta's Chief Medical Officer of Health, Dr. Dina Henshaw, announced on Tuesday that the province continues to see an overall decline in COVID-19 cases. There were 422 new cases of COVID-19 identified over the previous 24 hours in the province. Hospitals numbers are also continuing to decline, with 608 people in hospital with the diseases, 128 of whom were in ICU.
I'd like to begin today with an update on this week's reporting and our media briefings, as well as a reminder about an upcoming change to the Restrictions Exemption Program. As the number of cases and hospitalizations continue to go down across the province, we are reducing the frequency of these media briefings. Starting today, COVID-19 media updates will be held once a week on Tuesdays. Numbers will continue to be posted online Monday through Friday and shared on my Twitter account as usual, and we will provide additional updates if any emerging issues arise. As such, this will be my only COVID-19 media briefing this week as we mark Remembrance Day on Thursday. Remembrance Day is, of course, an important time where Canadians come together to honour the service and sacrifice of those who served and continue to serve our country. To help organisers host safe Remembrance Day ceremonies this year, we have posted guidance online at alberta.ca. I'd also like to remind Albertans attending any ceremonies in person to be mindful of the physical distancing, masking, and capacity requirements in place to prevent the spread of COVID-19. And as always, if you have even minor symptoms, please stay home.
3,071 vaccinated healthcare workers in British Columbia remain on unpaid leave, officials revealed Tuesday. Health Minister Adrian Dix said this number includes 1,032 casual staff, 989 full-time staff, 899 part-time staff, and 16 people whose job status is unknown.
Thank you very much and good afternoon. So this afternoon we'll be sharing the latest updates on our COVID-19 public health response and on vaccine delivery. And while this briefing is about COVID-19 primarily, I would like to start by speaking about influenza for a moment. As I mentioned last week, we've started to see a small number of positive cases of influenza in the community, just 4 so far, so still very low. But it is a marker to us that this virus also circulates and can cause illness. And every person in our province is eligible to get their influenza vaccine free of charge, everybody over 6 months of age, for which we don't have a vaccine yet. And we know that the vaccine is distributed across the province, primarily to pharmacies. They are our partners in delivering the influenza vaccine, and I encourage everybody. Now is the time to get protected from influenza as well, before the holiday season begins. Like COVID-19, influenza vaccine protects you, and it also protects those around you. And we know this is especially important if you are planning on visiting elder relatives or friends over the holidays, people in your family who have compromised immune systems. We've seen the devastating impacts of COVID-19, and this is compounded if we also have influenza making people ill as well.
Ontario's Chief Medical Officer of Health, Dr. Karen Murray, announced on Wednesday that the province is pausing the next step of its reopening plan as it sees an increase in some of its key indicators, including the effective reproductive number, the test positivity rate, and weekly case rates.
Good afternoon, everyone. Bon après-midi à tous. Today, there are 454 new cases of COVID-19 in Ontario. There are 243 people in hospital and 136 in our intensive care units due to COVID-related critical illness. And I am sorry to say that about another 9 deaths have been reported. A total of 33,364 tests were processed yesterday with a positivity rate of 1.8%. As far back as July, I spoke about an anticipated rise in cases as we move towards the fall and winter. We are now seeing this occur in some parts of Ontario. As the temperature begins to drop and more people move indoors, we can expect to see cases fluctuate or continue to increase over the coming months. While this is not cause for alarm, it will require continued vigilance from each of us, and we must stay cautious and disciplined in the face of this virus. Provided we follow public health measures and increase our vaccination rates, we can continue to manage transmission of the virus at a local level and minimize the impact on our hospitals and intensive care units. Tant que nous respectons les mesures de santé publique et que le taux de vaccination augmenteront, nous pourrons continuer à gérer la transmission du virus au niveau local et minimiser les impacts sur nos hôpitaux et nos unités de soins intensifs. The transmission we are currently seeing is predominantly among the younger age groups and the unvaccinated. And while the younger age groups are typically less likely to suffer severe outcomes from COVID-19, the virus still has the potential to cause serious illness and hospitalization. If someone is infected, even with mild symptoms, they can still transmit the virus to others who may become more vulnerable. This virus is not going away. There's no way of escaping it. So if you are not vaccinated, you are susceptible and at increased risk of serious illness and significant outcomes associated with COVID-19. We have safe and effective vaccines to protect yourself, your community, and your loved ones.
The United States faces renewed urgency to get more Americans vaccinated against COVID-19 as cases spike again in many states.
When visitors arrive in the U.S., they'll find a country still very much in the grips of the pandemic, with daily case rates on average almost 4 times higher than in Canada. Every single day, the U.S. still records an average of 1,200 COVID-related deaths and is on track to exceed 1 million deaths by March. In many states, the virus is surging again. 2 months ago, the Delta variant led to an explosion of cases in Florida, Texas, and the South. Today, the situation has reversed, with northern states like Minnesota, Michigan, and Vermont seeing the fastest rates of increase. Vermont also has one of the highest rates of vaccination in the U.S. at 72%. All of that is creating uncertainty about the winter as people gather indoors. Travel is expected to return to pre-pandemic levels for American Thanksgiving and the holidays.
Conservative leader Aaron Atoli is facing a political headache within his caucus after some of his MPs expressed concerns about the COVID-19 vaccine.
2 e-petitions in the House of Commons. One calls on the government to approve ivermectin as a treatment for COVID. Health Canada has already warned Canadians it is dangerous to take that drug. And the other petition asserts that vaccines are not proven safe and that vaccine passports should be banned. But it is not just Allison. At least 5 other Conservative MPs have also been raising concerns about vaccines on social media, in petitions, and in news columns. And that is creating a political headache for Aaron O'Toole, who wants his caucus to send a different message.
Vaccines are safe. You're right, David. And all of our MPs are talking about that responsibly. And where people have not, our caucus will be addressing that. We are addressing that. We all have a role to play.